stopped eating.
Spot cut his paw.
Can cats catch a cold?
I didn't know that.
Hey, Dr. Mike.
We're never short on questions for this guy. It's time to ask Dr. Mike, and today we're talking about being prepared for an emergency with your pets, as well as alternative healthcare treatments for pets that are in pain. We want to welcome Mike Hutchinson. Good morning.
Good morning. How are you?
I'm great. And you say that it's National Disaster Preparedness Month. It's also Responsible Dog Ownership Month.
That's exactly right. And they kind of go hand in hand, really. But National Preparedness, they tell you, and I agree with this, that you should always have a first aid kit for your pets. You should also have a plan for 2 weeks. So if something were to happen, an emergency were to happen,
right,
you have food, you have the appropriate carriers, you have ID, you have copies of their medical records, you have recent photos, you have waterproof carriers for those things, because you never know what the weather is going to be like in that emergency. And all of that, and I would prefer, I just read a story this morning about a dog in Texas that has an Avid ID chip implanted in it, and it got lost. So I'm sure they're going to find that poor dog, when it's lost. So if you could get an ID chip, that would be a good thing too into your animals, because it's a permanent ID. So even if they get their leashes or the collars off, you still have a way to identify them and get them back.
For people who maybe want something like that, would your vet do it?
So veterinarians do it. Some of the shelters do it too, and a lot of places. Just know that if there's a lost pet, the first thing everybody does, if it's brought into our facility, everybody scans it for that chip. We even go as far as, if we scan and don't get a read, we'll sometimes take an x-ray and make sure, because you can see the chip, make sure our reader is, because they're supposed to be universal readers, but there are sometimes they don't function properly. So we even look to make sure that there's not a chip there. So it's a really good thing to do. Everybody scans for that chip.
Well, so when we're thinking about emergencies, how can you really be prepared for all of them? You never know what could happen.
That's exactly right. And so around our area, we're not as bad as, say, down in Florida or California, where they have the fires and things like that. But we can have disaster strike. Any of us could have that strike. And so there's nothing wrong with being prepared. And this was a month to focus on that. And I like to share that. You remember when Katrina occurred, we ended up with a lot of dogs that came up here from that Katrina to get adopted. And there were very few people planned. And now the federal government accepts our pets in the emergency evacuations. But if you don't have proper restraint, proper carriers, what are you going to do? You got to have leashes. You got to have this stuff just in case.
Just in case.
And it's not a bad thing. You're talking about 2 weeks supply of food, water, something that you could collect very quickly and protect them.
So Dr. Mike, you and I have talked about before, and I found this very fascinating. You've been looking into alternative treatment for pain for pets. Yeah,
I did a podcast on cannabis oil. I get asked about it all the time. And cannabis, marijuana has more THC in it, which makes them high. Cannabis has more cannabinoids in them, which doesn't make them high. It helps pain. It helps things like seizures, anxiety, and calm. It can calm pets. It's very effective in some of our pets that we're using it on. I don't sell it at the practice. You can get it online. There's some rules with the government. They still haven't, the DEA still hasn't classified marijuana as anything but Schedule 1. But I hope they take that down so all of us can provide this. And it does matter where you get it. I did a podcast on this with one of the world-renowned experts, Rob Silver. He's out in Colorado, a veterinarian. He's, the human side looks to him, the animal side looks to him. He really was a good expert. I know stem cells real well. When I was talking to him, he knew about the cannabis and animals like I know the stem cells. He's amazing. So I learned so much sharing and talking to him, and I like to share that with people. There really are good cannabinoid receptors in our pets that we can help with some of these hemp oils and things like that.
Well, and there are certain things that we don't have to worry about in our pets too, like they're not going to get behind the wheel.
Right.
But
there
are things you don't have to worry about.
This isn't. When I was in the emergency clinic, I would see animals that came in high, and some of them died. I mean, they had receptors in their heart, and it caused a heart attack. Most of them have it in their frontal lobe, and it inhibits them. They don't enjoy it. It's not an enjoyable experience for them, so it's not funny. And but with cannabinoid, with hemp,
you don't get that.
You don't get that. You get the cannabinoid receptors, which does not cause a high. It helps all those other things. And they say dogs have about 99 cannabinoid receptors. Cats have quite a few too. So why not try it if everything else is failing, especially if they have cancer? And some people in my practice have used it and are very happy with it. And there are differences between the products, and maybe go to the website or the podcast and they could find out what was recommended.
Okay, certainly look that podcast up. Thank you so much, Dr. Mike.
You're
Very
welcome.
interesting take on that.